All right. Good night, everybody. This is Jennifer coming to you for another Facebook Live here. I am coming from Fort Worth, Texas, and here it's 8 o'clock Central Time. However, I know many of my friends are on Central Time and all over the country. I'm trying to fix the camera right now because the light behind me gets some nice light in here. Hey, Nellie. And then also adjusting to my new glasses that I got because they're also progressive lenses and transitional lenses at the same time, especially living here in Texas. So tonight, one of the things, as I'm constantly adjusting the camera, wanted to talk about is your healthcare benefits, especially when I went and got my glasses. There's always an issue of just because somebody says they accept your insurance doesn't mean that it's actually in network. A lot of places, especially when it comes to something specialty like eyeglasses, such as mine, when you get your medication card, prescription card, especially for dental and vision insurance, it will say something as preferred providers. Mine especially said Provider Plus, which for me was Lens Crafters, which I'd never used them before, and using the eye doctor next door, which was fine. But I know there's a lot of other places like Target, Walmart. They also have optical places for you to get your eyes checked and glasses frames over there. So we were at, Target walking around. It was like, oh, let's look, just frames, just so I could kind of get an idea of what was out there. And we were talking to the person, and the person didn't really know what my benefit was for the glasses. They're like, oh, we can look it up. It's blah, blah, blah. It's this for frames, this for lenses. And that didn't sound right to me because, one, I had just double checked all that. And the difference was about like $75 difference of the allowance of frames. So that did not make sense to me. So we asked if she would be willing, the person at the eye doctor's office, actually at the frame place at Target, hey, can you print up what you're saying my insurance will pay for? They said no. So we're like, okay, peace out. We'll come back later if that, but I was going to go home and look at the actual benefit amounts for what the breakdown was for lenses, for frames, for just certain coding, because also if you have, there's a difference if it's progressive lens, single lens, if you're also getting contact lenses, if you want transitional lenses, any type of anti-reflective, all of that stuff adds up. And depending what your allowance for frames is. So this is why it is so important to know what your benefit is and to also make sure it is within network, because just by going then probably 10 minutes away down to the Lens Crafters, I saved myself actually probably at least $150 on my glasses, which are super cute. Love them. By one going in network, also they were able to apply like a $50 coupon, which is really great for using them. But if I hadn't known what my benefit level was, I could have actually ended up paying way more or paying out of pocket for the glasses than allowing my insurance to pay for everything. And that's a lot of times what happens within healthcare is many times we think, oh, well, this person that says that they're in network, or ZocDoc says they're in network, which some of these apps are really great. They give you ratings. However, the big issue is unless you actually get that list from your insurance company that's up to date. And that's kind of what you want to do before finding new doctors, is get a list from your insurance company. You can call the number on the back of your card. You can also call them up, say, hey, I'm looking for a provider in this area who's taking new patients. It saves you a lot of time. They're doing the work for you. It's great. I've done this many times when I've had to switch insurance companies. And that way it also saves you time from having to do that research of who's in network. Now, once I get that list, yes, I absolutely look at the ratings of these doctors. But however, you want to be careful of doctor's office, especially specialty doctors and dentists and eye doctors saying, oh, we're a network. Well, just because they accept your insurance, they might accept your insurance, but you might have a bigger copay. You might be paying way more out of pocket. And I'm here to try and save you money on healthcare because healthcare is expensive. And this is like one way I have learned to advocate for myself, especially in nursing and with my own healthcare. If something doesn't seem right, like I knew what this person was quoting me for the glasses. I was like, that's not, and I even told her, like, I'm sorry, that's not what my paperwork says back at home. And for not letting me like have the form to compare. So a lot of times don't feel guilty about like walking away from a situation like that, especially one when financially it doesn't make sense for you with something like that. And also another way to save money on healthcare is having your flex savings account. And also if you're in between having insurance and still need medication, a lot of times if you have a really good rapport with like your family doctor, they, even if you've maybe lost your insurance, you can, sometimes call them up or send them a message if you still have, the login. I know a lot of people have the electronic charts, the My Charts, that type of thing, to where you could be able to log in, send them a message, hey, I need meds, I lost my job, can you give me like a 3 or 4 month or even 6 month, enough refills. And GoodRx, for the majority of medications, you'll save a lot of money if you don't have insurance using that. Because I know for myself, I've experienced this, going through this right now with having insurance at my new job and changing all my providers, which needed changed anyhow, and getting providers that are closer to me now that I am on this side of town. And even for myself, advocating with providers to get appointments quicker. Many times you can ask to be on a wait list if there's a cancellation, which is a really good thing. And if you tell them like, hey, if there's any cancellations on this, on these days, please call me. A lot of providers are really good about doing that. Also, for a lot of people, using the telehealth option now, especially since COVID, really great option. I did that for one of my appointments today during work. Took my break in my office during that time, thankfully. Gave somebody some paperwork to fill out, said, hey, please fill out this paperwork. I'm heading into a meeting. I will check on you after the meeting's done. Got everything I need to do with my doctor. And then that person was still filling out forms when I was done. So a lot of times telehealth visits can be done and you don't even have to travel. Now there's certain appointments when I have to get my injections, I have to go in person. So these are just some tips and tricks to help you save money on your healthcare, and also advocating for yourself, advocating for what you need, especially in healthcare, where so many times we feel, especially healthcare providers, feel like a burden if we're asking for help or what we need, because we know everybody else is so stressed and their burnout rate is super, super high. However, ask for help, because people are not mind readers, and a lot of times they really want to help, and sometimes they just don't know how to help, especially as we're so burnt out. And one of the really good way to keep from getting burnt out is making sure you're taking care of yourself, especially your health care, and be a big advocate for that, because self-care is not just all the beautiful bubble baths, massages, facials, which are great. Love them, by the way. However, self-care is also physically, mentally, emotionally, financially caring for yourself and making those doctor's appointments, making those eye doctor appointments, making those dental appointments. So you're the one that needs to be in charge of your health to be able to take care of your patients and your families. And so these are just a couple ways to advocate for yourself. And please reach out to me if you're in healthcare and just feeling that burnout, feeling that tug, because I've been there, I've walked it. I know what it's like as a nurse with 20 plus years experience, and I know what's waiting on the other side of that. There was times I felt like walking away from nursing. However, I'm really glad I haven't, because now having a seat at the table with leadership is really being able to make a difference and an impact. And that's what I want for you, is to be able to find the joy back in nursing as I have. So I have some great resources on my website at Sacred Solutions Revolution. So please go ahead, check it out, and have a great night. And I love you all so much, and I will see you next week.